Hello everyone, this is Payal Vaja. In last lecture, we have completed orally ingested tablet and today we will discuss second class tablets that are used in oral cavity that have three subtypes. First one is buccal and sublingual tablets. Next one is troches and lozenges. And last one is dental cones. So first of all, what is buccal and sublingual tablets? Buccal tablets are small, flat tablets intended to be held between cheek and teeth or in cheek pouch. That means buccal tablets are defined as a small, flat lozenge intended to be inserted in buccal pouch. Next one is sublingual tablet. Sublingual tablet which are placed under the tongue. Buccal and sublingual tablets release the drug content for absorption directly through oral mucosa. That means they release the drug content for absorption purpose with the help of oral mucosa. They are designed not to disintegrate but to slowly dissolve over a 15 to 30 minute period. Buccal and sublingual tablets produce systemic drug effects as the drug is absorbed from oral mucosa to bloodstream, leading directly to general circulation. That means buccal and sublingual tablet produce systemic effect when drug is absorbed from oral mucosa to bloodstream, and they should be formulated with blend excipient. So what is blend excipient? Blend excipient are used to avoid salivary stimulation. Advantages: it produces rapid onset of action, it avoids first pass metabolism of drug, and buccal and sublingual tablets protect the drug from extensive decomposition of gastric environment. Next one is troches and lozenges, disc-shaped solid dosage form which contain medicinal agent and flavoring substance in form of hard candy or sugar base. They are intended to exert a local effect in mouth or throat. That means troches and lozenges produce local effect in mouth or throat. Commonly used to treat sore throat or to control cough in normal cold. That means troches and lozenges most widely used for throat infection or to control cough in normal cold condition. Troches and lozenges which may contain various agents like local anesthetic, antiseptics, antibacterials, demulcent, astringent, and antitussive agents. They are designed not to disintegrate but to dissolve or slowly erode over a period of 30 minutes or less in the mouth. So first of all, what is lozenges? Lozenges are also called as pastils or cough drop. They may be made by or prepared by compression, but are usually formed by fusion method or by candy molding machine, whereas troches that are made by compression method. Last one is dental cones. Dental cones are designed to place in the empty socket remaining following a tooth extraction. That means dental cone are defined as a solid bounded by a circular base covering upon a single vertex and intended for administration to the teeth and gingiva in the oral cavity. It is formulated to dissolve slowly in presence of small volume of serum or fluid over a 20 or 40-minute period. That means dental cone are formulated to dissolve slowly in presence of any fluid or serum within a 20 or 40-minute time period. Uses of dental cones like first one, to prevent multiplication of bacteria in socket by employing a slow releasing antibacterial effect. That means dental cones are act as a antibacterial agent and that are also used to reduce the bleeding by containing astringent or amino acid. Remaining portion we will discuss in next lecture. Thank you.